We have discussed till now type 1, type 2, type 3, and type 4 hypersensitivity. Today, the last part of hypersensitivity, that is type 5 hypersensitivity, we will discuss, which is called as stimulatory hypersensitivity. Why it is called as stimulatory hypersensitivity is because the autoantibodies that are produced against the one of the particular cellular receptor stimulates that receptor as though some natural hormone is binding to it. With the result, that receptor gives the signal to the cells concerned to respond in the same manner as though they would have responded to the hormonal stimulation. Now let us see which is this receptor that is involved. The receptor involved here is called as thyroid stimulating hormone receptor. TSH receptor, thyroid stimulating hormone receptor. This receptor is present in the thyroid, on the thyroid follicle cells, and the thyroid stimulating hormone produced by the anterior pituitary, that is adenohypophysis. Anterior pituitary produces TSH, thyroid stimulating hormone, that comes and binds to this receptor, TSH receptor, on the thyroid follicles and stimulates the thyroid follicles to produce thyroglobulin, that is the thyroid hormone. Okay, so this is the natural process where thyroid stimulating hormone secreted by the anterior pituitary comes and binds to the receptors on thyroid follicles and stimulate the thyroid follicles to produce thyroglobulin. Now this thyroid stimulating hormone receptor, once in a while, due to autoimmune response, gets bound by the antibody. The antibody to the TSH receptor, after binding, will stimulate the thyroid follicles to produce the thyroid hormone in the same manner as though the TSH hormone had bound. In diagrammatic representation, if I have to show, it is like this. This is the normal process where TSH comes and binds to the receptor, stimulates the cells to produce the thyroid hormone or thyroglobulin, and that TSH comes from the pituitary gland. Now, to that TSH, thyroid stimulating hormone receptor, the autoantibody comes and binds. Once the autoantibody comes and binds, it will stimulate the cells to produce in the same manner. Remember, the previous natural response is a very well regulated response. No excess hormone, thyroid hormone, is going to be produced. It is a feedback regulation. Whenever there is sufficient quantity of hormone, it directs the pituitary to stop producing TSH so that the thyroid will stop producing the thyroglobulin. That well regulated machinery or mechanism will be disrupted when the antibody for the thyroid receptor, thyroid stimulating hormone receptor, comes and binds, and it will continuously stimulate the thyroid cells, follicle cells, to produce excess of thyroglobulin. The production of excess of thyroglobulin hormone is called as Graves' disease, which is called as hyperthyroidism. Hyper, Hyper, means excess, hyperthyroidism. This also leads to, because of the overstimulation of the thyroid follicles to produce excess of hormone, those thyroid follicles will accumulate more of hormone into their cavity. With the result, swells, and it is going to give rise to hyperthyroidic goiter. It is called as goiter. Goiter can occur in two different ways. When there is deficiency of the thyroid hormone, also goiter can take place, or when there is excess of thyroid hormone, also the goiter can take place. Goiter is nothing but swelling of the thyroid gland on either side near your pharynx, and the neck will be swollen because of the swollen thyroid gland. So the Graves' disease is nothing but autoantibodies come and bind to TSH receptor, stimulating the thyroid follicle cells to produce excess of thyroid hormone. Now what happens? These antibodies that are bound there, they will not keep quiet because there is antigen antibody complex which is already formed. Initially, the response will be hyperthyroidism. As the antibody complex with the receptor increases in the thyroid, slowly that antigen antibody complex will initiate complement binding. And you know what happens when the complement comes and binds to the Fc arm of the antibody. It will initiate complement mediated lysis. And the complement mediated lysis will be the lysis of the thyroid hormone producing follicle cells. Each follicle cell which is bound by the antibody to the TSH receptor will initiate lysis of that cell through the complement mediated lysis. Over the course of time, the person will suffer now. Initially, he was suffering from excess of thyroglobulin hormone. As the time passes away, he will suffer from decreased thyroid hormone. And that decreased thyroid hormone will result in another type of goiter, and that is called as hypothyroidism in the later part of the disease. And this may also initiate not only complement mediated lysis, it may also initiate ADCC response, antibody dependent cell mediated cytotoxicity, that also results in lysis of the target cell. Ultimately, the thyroid gland disappears because almost all follicle cells will be damaged and the place of thyroid gland will be occupied by the connective tissue. The person will suffer from hypothyroidism and there will be no more function of the thyroid. Then he will have to depend on external source of the hormone, that is thyroglobulin. So this is the state of affairs with type 5 hypersensitivity, where stimulatory hypersensitivity results in stimulation because of the antibody binding to TSH receptor. There is another type of disease. In some individuals, the histamine are in the gastric region, that is in the stomach area or in the intestinal area, will get bound by the autoantibodies. The histamine receptors get bound by the autoantibodies. And when those autoantibodies bind to the histamine receptor, they also bring about the same type of stimulation where excessive histamine will be released in that area, resulting finally in an inflammatory response. Because you know that when histamine is released in excess because of the receptor stimulation, release of histamine will cause lot of inflammatory cells to infiltrate that area, and those inflammatory cells will cause damage to that area, and that area will develop the ulcer, and that gastric ulcer will not respond to medication. It is called as the drug resistant ulcer. Okay, there are drugs that are specified for the gastric ulcers. One of the drug is called as cimetidine, cimetidine, cimetidine. Generally, this is the drug that is prescribed for the people who suffer from gastric ulcer, and that drug will bring about curing of that ulcer slowly. And it is found that those people who develop the autoantibodies to histamine receptor, they will become cimetidine resistant ulcers. In the sense, they will develop ulcer which will not respond to the drug. So these are the two examples that you can give for type 5 hypersensitivity. Okay, that is as far as the types of hypersensitivity is concerned. I will stop this slide and move on to the topic, that is autoimmune response. Okay, I will switch over to the next slide, that is about the autoimmune response. So the autoimmune response shown by an individual or that appears in an individual is because of misregulation, and that misregulation is because of the loss of tolerance. The loss of tolerance is The loss of tolerance is because the self antibodies will be produced against the self antigens. So, autoimmune response is nothing but production of antibodies due to misregulation against the self antigens. Or, in other words, you can also define autoimmunity as loss of tolerance against self antigens. There are self antigens against which you know that I had explained to you in B cell maturation process and T cell maturation process. Both these cells that are responsible for the immune response have been conditioned or made to learn as they are maturing to identify and develop tolerance to the self antigens. That is, B cells also develop tolerance to the self antigens and they don't produce antibodies against them. Similarly, T cells are also provided those self antigens on class 1 and class 2 MHC and then they develop tolerance. Therefore, they don't react to the self antigens. But unfortunately, that fine balance of regulation of self will be lost in some cases, not in all. It is not a common disease, but does occur in beings due to loss of immune regulation of self tolerance. And that self tolerance, that fine balance of identification of the self antigens and the non self antigens may be lost. When it is lost, the person will start recognizing his own self antigens as foreign antigens and mount an immune response against them. Now, first we will see what are the factors or reasons the person may develop autoimmune response with different examples. So, the examples are here, that is, chemicals could cause autoimmune disease. There are chemicals which can initiate autoimmune disease. And you know that there are cells that age in the body. When they are getting removed from the body, there are processes. And those processes may initiate autoimmune response against the aged cells. And that autoimmune response initiated against the aged cells on the normal cells. Then exposure of hidden antigens. There are sometimes some antigens which are not exposed to T or B lymphocyte. And there are sites in our body where hidden antigens are present. We will see what are those. Same way, sometimes new epitopes are created in the body and those new epitopes will act as foreign epitopes and they initiate autoimmune response. And there could be possibility of cross reactivity where the antibody developed against the antigens or the epitopes of the microorganisms will cross react with our self antigens, which is called as molecular mimicry. Okay. Similarly, viruses also can induce molecular mimicry, and sometimes the hormonal imbalance at a person in a person during aging may also initiate the autoimmune. One by one, let us see how the autoimmunity can be initiated where there is no hereditary predisposal, but the person may suffer. But it's not very common. Don't be alarmed. It may happen by accident. Let's see here. Now, the miners or those people who work in cement industries or rock crushing industries are being continuously exposed to silica. And that silica which comes in contact with your body on the skin as well as you internalize it means you are in fact inhaling small micro silica particles and that may form a complex in your body in such a way that even though it is an insoluble substance it could initiate a kind of immune response which is a rheumatic immune response which is called as on the skin which is called as scleroderma where sclero refers to hard, derma refers to the part of the skin. The skin becomes so tight and stiff that the person will find it very, very difficult to even fold fingers. Everything will become very stiff. Elasticity of the skin will be lost due to excess of collagen secretion which is triggered by the autoantibody, and that collagen gets deposited in the skin, making the skin bulky. And by making the skin bulky, the skin appears as though it is swollen, loses its elasticity, and will not be able to stretch. So therefore, finger joints or your palm, any area of the body where the skin is covered, that will be stiff in appearance. You find it very, very difficult to handle things, and the skin looks glossy, means glassy in appearance or glossy shining, as though there is some oil has been applied on the skin. And most of the time, the person who develops scleroderma may lose the hair follicles, because of the tautness or tightness of the skin. So person who suffers from scleroderma will have terrible problem. Even he will not be able to speak. Why? Because the lips will become very tight. The face will become very tight. He may not be able to smile, and he may not be able to show expression on his face. Okay, lips also becomes very, very tight and find it difficult to speak also. Okay, that is as far as scleroderma is concerned, caused by a mineral, that is silica. Then comes, I'd explain to you about this in type 2 hypersensitivity. Some drug haptens, okay, drug haptens which bind to the proteins in the body would cause autoimmune response and loss of those cells. One of the example is penicillamine. Penicillamine is the derivative of penicillin. Okay, and that penicillamine or penicillin derivative cause development of the antibodies, and those antibodies which are produced due to the complex of that penicillamine with a protein will mimic the acetylcholine hormone which binds to its receptor. Okay, acetylcholine hormone is supposed to bind to the receptor, acetylcholine receptor. Now imagine the penicillamine forming a complex with a protein in the body has developed the antibody, and that antibody goes and binds to the acetylcholine receptor. And when it binds to acetylcholine receptor, the person will suffer from a disease called as myasthenia gravis. Myasthenia gravis is a disease. When it initially starts, when a person can identify this disease, where the person will lose the ability or voluntary ability of closing the eyes. You can imagine and you can sense it. If you desire, you can close your eyelids, but eyelids close and open without your desire also, without your willingness also, because it is autonomic. They are cleaning your eye by closing and opening without your knowledge. But when you desire, if you want to close your eyes, you can close your eyes. But when a person suffers from myasthenia gravis, the person will be unable to close the eyelids. Eyelids will be fixed and the gaze will be fixed. The person will not be able to close the eyelids. That is the initial symptom of loss of voluntary movement, because acetylcholine receptor is being engaged now by an autoantibody. Okay, and there is a possibility of excessive steroid hormone application. A person suffers from a massive accidental injury and he goes through surgery and operation. After that, to reduce the inflammatory response, the person is administered with the steroid hormones or corticosteroid as an injection. Sometimes, for in some people, that excess of corticosteroid administered to prevent inflammation may initiate myasthenia gravis like symptoms. Myasthenia gravis like symptoms. Mr. Amitabh Bachchan, when he had suffered the accidental injury during his movie in Coolie, when he was shooting for Coolie, he had suffered internal injury of the intestine. And that injury, during that injury, he was treated with corticosteroids. And when he was treated with corticosteroids, he had developed this myasthenia gravis like symptom. Now, here it is temporary, but whenever the drug myasthenia gravis takes place, that person should avoid that drug. That drug is responsible for the formation of the autoantibodies. Similarly, the drug could also lead to hemolytic anemia. If it has formed a complex on the proteins of the RBCs, the autoantibodies will react with the RBCs and bring about the lysis of RBCs. And that will be dangerous. The person will suffer from anemia. Similarly, there are other examples like mercury salts. Whenever mercury salts are in excess due to environmental pollution in drinking water or in the food material that is consumed by the person, it may lead to autoimmune glomerulonephritis. Means the basement membrane of the basement membrane of the kidney is going to be destroyed because of the mercury salt complex with some protein in the body, which has developed the autoantibody that destroys that basement membrane of the glomerulus, resulting in glomerulonephritis. So iodine in excess, people say iodine is required for the healthiness of the thyroid. Iodine is added in the salt, or if you consume the raw salt which is extracted from the seawater, there is no need of supplementation of iodine in the table salt. Nowadays, the table salt is a refined salt which will not have iodine because it goes through the process of heating and vaporization and crystallization. That time, iodine will evaporate. In that, they add iodine. The table salts that are available in the market now, all are supplemented with iodine. And that iodine that is added to the salt, one need to add in a proper proportion. If excess is added, that iodine itself will become a problem for the person, where it may induce immune thyroid disease, where that iodine will form complex some proteins and initiate autoimmune response, and destruction of thyroid may take place. And this is as far as chemicals are concerned, which can initiate autoimmune response. Now let us see about the removal of aged cells. First example is removal of aged RBC. You know that RBCs will spend 120 days in you and then they are getting destroyed. How they are destroyed? Generally, there is a mechanism for destruction of the RBC. They have a glycoprotein on their membrane, which is called as anion transporter glycoprotein. And that glycoprotein is also called as band 3. And due to the action of serine protease in the aged RBC, that protein is cleaved, then the extracellular domain is lost. The anionic transporter glycoprotein loses the extracellular domain, and a short stubble will remain on the membrane of the RBC. Okay, and that short stubble that is remained on the membrane of the RBC has an antibody to it, which is IgG antibody. It is recognized by the IgG antibody produced by our body. But that antibody produced in a regulated manner, in a definite quantity. That antibody comes and binds to that band 3 protein, which has been cleaved by the serine protease. If it is not cleaved, antibody cannot recognize it. Because of its cleavage, antibody recognizes it, comes and binds. As soon as the antibody binds, C3 complement comes and binds to it, and that C3 complement, which is as C3b, will initiate phagocytosis of that RBC by the macrophages. And this process takes place in the liver also. Okay, phagocytosis by the macrophages. And now the balance of antibody binding and C3 complement coming and binding to the body and destruction of that RBC by phagocytosis is well regulated. Means the amount of antibody produced is in definite proportion, and activation of C3 complement is also in definite proportion. Now let us presume it goes haywire. The antibody that is produced will be also in excess, as well as which will show high affinity, and initially it was showing low affinity, it will show high affinity, and excess C3 complement is produced. That will result in reacting with other cells which also express band 3 protein. And those cells will be platelets, neutrophils, lymphocytes, hepatocytes, and kidney cells. It may react. It need not be all of these at the same time. It could be any one of them. And imagine if the autoantibody that is produced for destruction of the RBC goes and destroys these cells, one will feel the deficiency of these cells and may suffer from deficiency syndrome. Neutrophils deficiency is called as neutropenia. Lymphocytes deficiency is called as lymphopenia, which may result in B lymphocytic deficiency or T lymphocytic deficiency. Platelet deficiency will result in non-clotting of the blood, and kidney cells destruction will cause kidney failure. This is the type of autoimmune response that could take place in the process of aged cell removal if it is misregulated and not controlled properly. Then we will move to another mechanism which may initiate autoimmune response, that is exposure of hidden antigens. I told you there are some organs in our body and there are some cells in our body which express antigens, and those antigens have not been exposed to the lymphocyte origin because they are in a place where the lymphocytes will not be reaching. One of the example is central nervous system. I had told you that central nervous system is well protected by the meningeal layer, and that meningeal layer does not allow the blood to pass through it. It allows only the blood components to diffuse through it, like nutrition, minerals, and possibly the micromolecular antibodies. Okay, so central nervous system, cardiac muscle, our heart muscle. There are antigens which are expressed by the cardiac muscles which are not exposed to the blood or exposed to the lymphocytes, even though the heart is the major organ of pumping of blood. It is hidden in the heart. Similarly, testes. Now let us presume that the person suffers an accidental injury, a massive accident, and the head injury takes place. And when the head injury takes place, you know that the skull may be damaged. Part of the skull may get ruptured, or the skeleton of the skull, that is the skull bone, may be ruptured in such a way that it will poke inside and rupture the blood vessels. Now, when the brain or head injury has taken place, the blood that is released in that area will sample the antigens of the central nervous system. Because the blood was not exposed in the brain area earlier. Because of the injury, mechanical injury that has been caused due to the accident, the blood released in that area has now sampled the antigens of the central nervous system. And once it samples the antigen, it will produce antibody against that antigen because till now lymphocytes were not exposed to that antigen. It will be considered as a new antigen and a foreign antigen, and your body responds to it as though it is a foreign antigen and produce the immune response against it, and antibodies will be produced, and IgG can easily pass through blood-brain barrier. They can pass through the blood capillaries, no problem. So then the slow damage of the central nervous system will start, and as the person recovers from the injury, slowly he will start losing certain sensations, or he may start losing speech, or he may start losing mobility. All these problems will be experienced by the person because the antibodies will be destroying his central nervous system cells. Same thing can happen if the spinal injury takes place. Spinal area, entire spinal cord is covered by the meningeal layer. And when the spinal injury takes place due to the accident, and if the person gets exposed to the blood in the spinal injury, the spinal damage may take place due to the antibodies, and person may start losing sensation in different parts of the body because of the spinal, the antibodies destroying the spinal nervous system. Okay. Similarly, testis also. Testis is not exposed. Testis antigens are not exposed to the immune cells. And when the accident takes place in that area, probably the testis antigens get exposed, and the testis may get destroyed by the antibodies, and he may become totally impotent. Then cardiac muscles. You have heard about the person suffering from myocardial infarctions, and it is an ischemic injury to the heart where the person suffers from loss of blood supply to the heart muscles almost die in that area. That is called as infarction. And due to the death of the heart muscles, those dead cells have to be removed. And when the dead cells have to be removed, the macrophages have to infiltrate that area because they are the dead cells. When the macrophages infiltrate that area and start scavenging the dead cells, which are dead in the infarcted area, they will sample the antigens, and if the self antigens are there which were already processed earlier, they will not get excited. But if they sample the antigen which was not processed earlier, they will get excited and they get activated and present that antigen to the T cells. And the T cells will mount an immune response on the heart. The person who has already suffered from cardiac muscle injury due to infarction may suffer now from the autoimmune destruction of the cardiac muscles. His muscles will start becoming, and they lose the elasticity, and finally it may lead to heart failure. So myocardial infarct patients should take extreme care and continuously keep monitoring the condition of the heart. Otherwise, they might have recovered from the infarction, they might be there on medication now, but they may suffer autoimmune destruction of the heart, and that need to be taken care due to heart failure. Okay, so that is as far as hidden antigen exposure is concerned. Now let us see formation of the new epitope. When does the new epitope form? I had already discussed this when I had discussed the type 3 hypersensitivity. In the type 3 hypersensitivity, when the immune complex is going to be formed, which is the preceptin complex, that preceptin complex of the soluble antigen with the antibody can get deposited in different parts of the body, and I had also mentioned that it can initiate rheumatoid arthritis. And remember, when the antibody binds to the antigen, the antibody structure is changed. Structure of the antibody is changed. And because the change in the structure of the antibody, it may expose a new amino acid residue on its Fc arm or Fab arm as an antigenic epitope. The immune complex, which has formed, will expose a new epitope because of the structural change in the Fab arm or the Fc arm of the antibody. And that new epitope exposed by the antigen antibody complex will initiate the another antibody production against that complex. And the other antibody which is developed is called as rheumatoid factor. The rheumatoid factor could be IgG antibody or IgM antibody, either of the two. The rheumatoid factor is nothing but autoantibody developed against the preceptin complex which had already developed in the body due to excess antigen antibody complex. And that rheumatoid factor will have its action in that area, and it will initiate the binding of complements. Initially, that preceptin complex also will initiate complement reaction. Similarly, the new antibody that is produced also will initiate complement factors that will cause massive damage in that area. And imagine this rheumatoid factor will cause damage in the joints. It will lead to rheumatoid arthritis. Joints will be destroyed. And if this complex is deposited in the kidney will be destroyed. I had already explained to you about this. Then second possibility, immunoconglutinins. Please note the spelling. Immunoconglutinins. Conglotinins. These are nothing but the antibodies produced against the complement complex. As you know, the antigen antibody complex is formed, the complements are activated, and you know that C2, C4, C3 complements will come and bind, and the complement complex builds up on that area where the antigen antibody complex has been formed and bind to this immune complex. They, being the glycoproteins, they show change in epitopes. And when they show in epitopes, and if it is there in the body for a long time, the body will recognize that as a foreign epitope or a foreign antigen and mount an immune response against it. And when the autoantibodies are formed against the antigen antibody complex, the two recognizing the complement complex, they are called as immunoconglotinins. They also bring about the same amount of damage was brought about by rheumatoid factor. They also cause same amount of damage. So this is how, when unregulated amount of things that take place in the body could initiate the autoimmune response. Okay, now we will move on to the other one, that is molecular mimicry or cross reactivity of the antigens of the microorganism origin, which initiate the antibody production, but those antibodies will cross with the antigens of your cells. Okay, now here the reason being, the epitopes of the microbial antigens share the same domains with the epitopes of the self antigens. Here, the shared epitope should be sufficiently similar to the self antigen, okay, to induce the cross reactivity, but also at the same time, they should be sufficiently different for the tolerance to be lost. Tolerance to be lost. And this fine balance of tolerance will be lost. And how that happens, we will see. Okay. So some epitopes of those pathogens, okay, due to evolutionary connection, pathogen associated molecular patterns, PAMP, pathogen associated molecular patterns, will initiate the antigen antibody production against those PAMPs. But those antibodies will recognize pathogen associated molecular patterns, epitopes on the host cells. Let me take an example of one pathogen, that is a protozoan parasite, Trypanosoma cruzi. When the infection takes place by this protozoan parasite, the person will suffer from a disease called as Chagas disease. It is pronounced as Chagas disease. And this protozoan parasite has antigens on its surface, which are mutable antigens, which keep changing. Okay. And those antigens are shared between the neurons and cardiac muscle of the person. The same type of antigens are there in the cardiac muscle and the neurons of the person. When the antibody is developed against this Trypanosoma cruzi in a person, those antibodies will cross-react due to molecular mimicry on cardiac muscle antigens as well as neurons. Then you know what happens. It causes neural degeneration. The pathogen has caused infection, and because of the infection of that pathogen, to build against it, at the same time that shared antigen has broken the tolerance of the self antigens. With the result, the person will suffer from destruction of his own organ. So we'll stop here. Thank you very much.